Remember, we are around to satisfy you with nothing but the best out of all. Tamakon Popoya, I do wish on our Vietnam West of Valachiba, Noega Losiqua, Noa Conamilo, Abalekemia, Miajamia Strong Lobo, a chode, one allergy, Tamia Sylvan Popo, prefigure to do an Aji, no henya to do all Adela Miaco Semoa, and the Mako Dogoa, a Giradobe, Afmia over. Maybe we'll cover up more that I want your fan. At 2, I don't want to work for lay up a teme. I can order one. So before I go on, I would like to take this opportunity to welcome them in the studio of 99.7 FM to give us whatever they have for we the journalists. Probably, and if there's time, phone lines may be activated for them. All right, come out of West on now. Fred, Avornyo, play Mr. Eddie, Ameh, but now when 7 apology. Very good evening to you, the gentlemen in the studio here.
Thank you and good evening.
So how is it?
Good, right. Shaman will say chichi, right? Because I left here in 1991. I don't know. Probably you were still running around that's when I left Bishop Herman. So, I'm happy to be back in this area, and I still have memories of those good old days.
Okay, please, you are welcome.
Thank you.
Welcome home.
Yeah, thank you.
Okay, is there Eddie?
Oh, well, I would also say it's a homecoming because I also used to frequent this place. But I was born and bred in Hawkeye.
Oh,
so, but we used to come to Kpando. I have a niece actually in Kpando, so it's also a homecoming for me.
Okay, please, thank you. Then you are also welcome home.
Thanks.
Okay, before we go on, we are going to mix it or blend it, right?
Yeah,
due to the area that,
Of course.
yeah. Okay. Medeku magakon ko ya do wezonami. Je vele akeva na ko se ya vola ji ke abale ke me va mi agba enye do jijo na mi be e me va mi agba be mi afia no mi cho mi a nya do la cho mi ano le mi avi yo de o ke le vigi no ikojia ezube do yila nya do mi va no cho mi do afokudo no yo de un do no ku via mi no kila chuno kukuta nya do angena wezona mi yake ake afnya ejia mako ya gode ya yivugwemelo PenplusBytes de mere ku medwe mi afnya ejia mi a onu ke ademi adokyo fia mi afenya sela fi ke tutu mi cho.
Okay. Akpa PenplusBytes yeah organization that again. I've been some coin now problem call pen plus the bytes. Know your bytes, I gigabytes. Computer no time. Do me when you be call computer. I'm a journalist on health issues. I can me a feel I call computer, I can call research, I call internet, I call research. I learn no number, I call figures over, I call data now. I learn now we pay a time report in the sad night in million. You have training me a watch up. So PenplusBytes, me work when me call computer. I call train journalist. I love me a fear journalist. I what I call computer. I call world dog one time when you there was there. They are come me well PenplusBytes. May I help know that they come well. Me train a journalist to mining, oil and gas. Maybe I train our directly the ICT chair.
ICT.
I catch your time. And so on. Maternal health. I can journalists what time or research. Or computer or research. Egbe WhatsApp to in a time you I call phone work na time internet information call. Ellen at time when you then what time our reporter, a seminar segome, more annoying. Yet,
that was bad. Me day one like the Jim feel like to me bear. That they want him to do allow a journalism. And we said it. Like you want by
but like more view 200 in your queen. Like and Najojo Agbolonya was a tuna.
Why you are in your bed?
One yabedi and look at two jojo. Accurate and giving accurate figures and then accurate information. Meaning very fear politics. Ya son koblomia journalist ole nkeke kioma or training na midi be mi na we be no dele politics e ji fide na no glo enu ele mia no ple mia vi nyonu mia tasio nu ele fude now ese menade ne po figures we le fifien maternal mortality mia no iwe ye koji eva kuna mia munuto me temia jio osogba ejebe mi deleji and Millennium Development Goals UN ope tadojinu fe vie to de kanya be mia be nyonu no yinova jivi wa gbo pele de viole untifa fame ta and ejebe mi wonu ke mi afasine su enu mi by next year 2015 voila figures ele mi asila mete mi ajo eta mi dibe mi na hehe journalist one no call enya ove ne mi poeda ne mi poleke amechichio wa o respond de eki obetem ta obetele me eta mi be mi na journalist
very close. Okay, Mr. Avornyo. Please, before going, is this the first time in the Volta region?
Yes, this particular training in maternal mortality, this is the first time, but this will not be the last time because we want to cover as many journalists as possible. So we hope that after this training, we will come back again with another set of training to have a lot more impact on the people.
Okay, so please, before we go on with everything, where is this taking place?
Now, the training is happening in Ho, but then we have selected journalists across the region. Now, what we did, again, because we are IT buyers, so we put the application online for people to apply. So some journalists applied, and then we selected them for this training. Now, we are doing this awareness creation in addition, so that next time when we apply, we'll see a lot more journalists showing interest in applying, so that from time to time we can organize this training program. So starting in Ho, it's a 2 full-day program.
And that's tomorrow.
Yes, heavily concentrated on maternal mortality issues. You know, so it's not a broad that you see that 2 days is not enough. We are just treating maternal mortality, how to report on it for 2 strong days, and we are hoping that after that we'll see better reporting on maternal mortality issues. For instance, like Dayi was saying, if you go to a place or maybe the Anfoega hospital and they give you a figure that, oh, this is the mortality rate or this is the mortality figure, as a journalist you should ask, oh, what was it last year? What was it 2 years ago? What was it 3 years ago? Then when you mention a figure, you also tell your listeners that, oh, the figure maybe is 400, but last year it was 600, 2 years ago it was 800, so it means it is getting better. But if you just put out the figure, nobody will make any impact. Or maybe if it is 200 this year and last year it was 100, then you tell people that, oh, it's 200 this year, last year it was 100. It means it's getting worse. And those are the techniques we want to train the journalists on, so that we can always report on this in a way that people will appreciate it, will feel and understand the story better.
Okay, please. Before we go on, we'll be coming out with some questions. But you said some of the journalists were selected on the online. So does that mean that you have some kind of qualification before you may be selected, or
No, we are just interested in people who are already working.
yeah.
So these are not people who are now going to the profession. So people like you, just that there are a number
Like
of
me with
yes,
that.
yes, I know. There are a number of journalists in the region. So and because we want it to be very effective, so we don't want a large number. We are taking only 13 people. So you can imagine the whole region.
Even if I were to apply, maybe I will not be.
Maybe no, it's not. It's possible you might be.
Okay.
So
Equal
again, this is
opportunity.
the first one. We hope to do some more, and not even just in maternal mortality, but in other areas. So we hope that as we've come here and been to other places, you also get informed. You will be in touch. You avail yourself to whatever is happening on the internet, so that next time when it's happening, because I would love to see people from Dayi. Yes, so that we know the information is going very far.
So with this, within the year, will you people come back, or that will be next year?
What we would like to come back to find out to be for those who have been trained to see whether it is impacting on the work. Over our training for the if you are the whole door.
We don't have the door.
Let me all and one way me.
The Saturday legend, I put them young one. As me, I got through.
Because I'm a dolly white train paper peg. I can over and you put over strong. You put there to the woman. Time. Let me tell me, I follow me over training. Me, I check, I find a body.
We know later when you're called Yagavania for the Ape. We say, Afim Yaga, Babiado lay up on a Kenya de Galasson, I could not get a Babia.
Oh, I believe it. Journalist came over for Monway back training, Omega teacher. Many 9-day one Dayo, do.
Miaga, Moncopo
Moncopo Galley, and Miape Didier Beddy, journalist, the share the Kele, Mia Munuto Medi, Anyanucho, Nukum, ne impact, Tidike Dimilen, result Dimilen, Mia Queta, ne journalist Dele. To do me me bo monu popo kemu mega chiju mile wogbe sigbanto eke and it's not the first and last, it is the first and the beginning. Okay, the omega chiji kwa konwo.
Okay, have me about you there, Wakona, Mr. Avornyo, and let's go with the quiz language. Okay, that's a quiz language. So, what is a maternal care?
Okay, well, I mean, essentially it's about taking the proper care of women, particularly in relation to childbirth. So, from the time that they take seed as they get pregnant, through to delivery and even post-delivery, to make sure that they are healthy throughout that period. What they need to do even to get pregnant, what they need to do when they are pregnant, what they need to do during labor, child delivery, and after that, all of that. And it is important because if we don't know what to do, or if they don't do what they are supposed to do, sometimes, or a lot of the times, it results in the loss of the child or the mother or both. And it's serious because we all know that when you have your mother with you, I mean you have an important tool. When a woman is educated, she will make sure that almost everybody she knows gets educated. We can't exactly say so of men, unfortunately. but so that's how important it is that we make sure that we don't lose the life of a mother because of childbirth. It shouldn't happen, not in the 21st century. So essentially that's what the maternal health care is about, and that's why we are driving this agenda. In the 21st century, it shouldn't happen. And if it is happening, then we have to work hard at it. And we think one of the ways we can do is to get journalists like your good self to be talking a lot more about this. You get yourself well trained, well educated, and you can discuss it a lot more. You can go on the internet yourself and research. For instance, this training will train the people to know how you can get information, where you can get it from, and how you can churn out the information so that people will understand it and enjoy it and follow what you're trying to tell them. So that is the essence of this. And back to your question, that is the whole issue about the maternal care.
Okay, please, thank you. Mr. D.
Yeah.
Let's hear your part.
Yeah. Yeah, as my big brother was saying,
Mr. Avornyo.
yes. Yeah. So how would these mothers be taken care of? What are the figures? I was telling you earlier that Volta Region together with the upper regions of Ghana have the highest rates of maternal mortality. We shouldn't be so, because we shouldn't be losing our mothers. And the UN has set a goal, that's the Millennium Development Goals, the MDG 5, that states that we have to achieve maternal health care by three-quarters of our mothers should not lose their lives. They shouldn't lose their children by 2015. And we are losing. We are losing them because we are losing the time. We are losing the race, especially against time, because 2015 and we are in 2014, and then the figures are still scary, and so it's also another reason why we are having this training, to make sure that at least we should reduce maternal and child mortality.
Okay, if you have a layer katame no care was be if you know allo may you got a for
they set the MDG target. The MDG target essentially is that we came together as a people, the whole world, that look, things are not too good. We don't have good health systems in a lot of countries. We don't have good education system in a lot of countries. People die needlessly in a lot of countries. So they came out to set targets that we should achieve. Achieving this target essentially is to improve on ourselves. So they've set targets for girl-child education, they've set targets for primary education in general, they've set target for poverty and all of that. And one of those targets is also to reduce maternal mortality. And so the target 5, or the MDG 5, is the one on the target on maternal mortality. And as I've explained earlier, it's important because we shouldn't be losing our mothers unduly in the 21st century. So, and we've made some amount of gains, but not enough to meet the target. And it's just next year. So we need to speed up. And we think that what we can do, I mean, there are efforts going on, but what we can add on is to get our media houses talking a lot more about this, so that our mothers, our sisters will get educated. So essentially, that's how we are tying it into the year target of 2015. We hope we'll get there, so that if we have a time where, for instance, Dayi will dedicate a lot of airtime to discuss health issues. Yeah.
Okay, I'm not stopping you there, but we have been doing that.
Yeah, so let's do more. It's good we are doing it. Yeah. Let's do more. It's never enough.
Yeah.
Because when you lose one life, it's huge.
Yeah.
I mean, that is the essence of what we are trying to push, and we are hoping that the journalists who get that training will do it well. You know, sometimes we will be doing it, as you say. The way you do it will also either make people be interested, or they'll just think it's one of those things. So again, at the core of this training is to tell the journalists how you can report so that people will enjoy it. If you listen to sports, see the way the commentators who go about it and won't enjoy it. Yes, we can equally discuss health issues in a way that people will love it and like to listen to it. But if it is dry, Yeah, nobody will mind you. In fact, we will not even take note of it. Time. Yeah. No message. Me just want to when one have discussion. Come on, put you. Hey, about radio. My say. Presenter now play questions so plans so na number. I'm a seminar GBA. I do to it. Yeah, cool.
Okay, care me agule amuganu to ame komile wa ele to come gbaja wona ya leji ele to come gbaja
mainly you want to be cool because your figures so many so me na abajo abe edibule na amongst in Ghana now you play the two upper regions, upper west and upper east. Your stories menu so takome concentrate there. Japan may improve it.
Avoid I look at Galileo.
Let me let Bopoloin. Mia Munuto, Mia Pena, Secra,
Joe, FBG, when young Nile TV, Waku, Viacha, Menyase, Miabete, Menyamedica, Dodasio, Miabete, Dodasio, Nabe, Demi, Pobobe, Mia no, Mia Dasio, no, hopefully the view no, we say, Avornyo. Have you achieved anything so far?
This is well with this training. The training is now going to start. But our ability to be here, to interact with you, and I'm sure your listeners have heard us. We see that as the beginning of an important achievement. But our men will begin to see the real benefits, and we are hoping that happens, so that we see a better way of reporting on maternal health, because it's important. So that is when, and as I said, we'll do the monitoring, we'll do a follow-up with the people we are training to see how well they are impacting, or how well the knowledge they've acquired is impacting on their work. Then we can say that, okay, we've gone pretty far, we've achieved so much.
Okay. So please, with all respect, that doesn't mean that if you were not been selected, you cannot be there tomorrow?
Yes, I mean, you might want to come and maybe for the opening, but you cannot stay for the training, because we want to, we just don't want to have just another training where people come and sit in and then walk away empty. So we are selecting only 13 people. That will ensure there's proper concentration in the class. Because if you are 30, you can't hide behind somebody and be playing through and see. We will see all of you. We'll be able to get everybody busy and occupied throughout the training program, so that you go back with some knowledge. So that's why we're keeping the numbers small. But as I said, this is just the beginning. So I'm sure there'll be other opportunities, and I can assure you, but we'll be exchanging contacts, particularly email, because that's the most effective way you can get some of these things. So that the next opportunities, we definitely will be involved. We might even want to come and do the training either in Anfoega or Kpando. So the impact will be a lot.
Like the next one to this Anfoega.
Okay. So let's keep that discussion open. For tomorrow, we are limiting it to those that have been selected, so that you can be very 1,000 can build maybe 100 cheap compounds. If you do the story that way, anybody listening will say, oh, okay, so with this money that they've saved, they can give us 100 cheap compounds. Then you will appreciate it better. But if you mention just the figure 300,000, it doesn't mean much. Yes, it's 300,000, but what does it mean? But if you say 300,000 and you can provide 100 cheap compounds, or even you can even do follow-up further to see, okay, the 300,000, why are you going to use that money to build the cheap compounds? So maybe even your story will say that, oh, if save 300,000 cities, you build 100 cheap compounds, and out of that 100, maybe 30 or so is coming to this region or coming to this town. Then you'll be telling a story that people will appreciate, people will enjoy, people will like to follow. If you just put a figure raw, it doesn't mean much. So that's how we're expecting that after the training, our journalists will better report so that the story will connect to the listeners. It's very, very important.
Okay, so please, after all,
Any of PenplusBytes program you want me Star Ghana, yeah, organization there. Because European countries so it's in Accra. That all projects, that all projects there want me Star Ghana. Toilet academy. Star Ghana torch and Star Ghana, my brother, Dayi change. Let me work program. We will propose that. Let me see. Let me tell you, then join. What I tell you, then you change. We explore. We know then we can have benefit. And you let Anfoega to me. You will me a and one you name me a catami pojo. Yaminto, I bear for American Jeff for town war, Edgy John, no Miadomesia, you know, one net. No, I knew me
a quick money you don't have like a Miko and I got it to me. And you got that when I start and I told her, where would I make me a Jimmy for Babiadi Cadena. Migai, a you women. So, how can journalists tell the story for all to understand in a simple language?
Okay, that's also very important.
Yeah.
Because sometimes, as a journalist, you might be tempted to use big words.
Yeah.
Or the person you met also use big words. And probably you're not too sure, so you just repeat that. But when you do that, you take a lot of people out.
Yeah.
And particularly when it comes to health. There are too many technical words in health-related issues. So instead of bringing back and saying all those big words to our listeners, break it down to simple words, very simple sentences. If you're not too sure, speak to that health professional to explain it to you. Then you can explain it to your listeners. Use very simple words. In fact, the best written stories are those written in very, very simple words. No one told me a story ago, then you are killing your listeners. Come back below. Time. You're also hoping that me a fiano, me a now, me a fiano, no call. I don't need you. We told you about journalists what call press release now. Figures so technical words one number never call me Galak Clena. Listeners,
if you are a journalist now, I don't decide them.
Let me mess go now. You're professional doctor, now your doctor know what they go now. Now, Segomena won't tell it. I call simple language. I call Gloria. They are elevating.
If you are a door, I need a federal dog by 2 at 1 seminar. The Nuita or the Fuma to Akbo video. You lay out with them a day, if I may you, Minabe, journalist, you don't hardly William Yakos if you like. Tahim Yagava where the Moka Jimmy Yaga too, I mean, 1 or 2, I feel like getting Yaji.
Okay. Hello, gentlemen. Me brother, PenplusBytes, Mr. Computer. Time. The first point of call, the segment, no check, www.